award winners all the way on the other coast join us. But I do look forward to the day when we'll be together in person again. There's just no substitute for that, but it's great to see everybody. So welcome to our 2022 Cottrell Distinguished Alumni Award Ceremony. Before we start with our Cottrell ceremony, we have a couple of announcements. And for the first one, I'm going to turn things over to Tasha Dean, who is the Associate Director of Strategic Communications for Scripps Gerontology Center. Tasha.
Hi, everyone. Thank you, Suzanne. I just wanted to talk about our centennial celebration. So as I hope all of you know, we're celebrating 100 years of Scripps this year in 2022. I'm hoping most of you got to save the date. If you didn't, you should definitely reach out to us so we can make sure you're on our communication email mailing lists. But let me go ahead and share my screen because we have a website I'd like to talk about real quickly to keep you all up to date with our centennial celebration. Can you guys see my screen? Okay, I see some head nods. So the biggest event is our in-person centennial celebration weekend in September. It's September 9th and 10th. We're going to have, it's going to feature speakers, roundtable discussion, a campus tour, an OMA session, and then it'll top off with a formal banquet Saturday evening. Here's our, it's a very, what do you call it? Not detailed schedule right now. More details are coming. We're still ironing those out, but it gives you a little peek of what that weekend is going to look like. Registration for the event is opening this month, well, in May, so next week. Stay tuned, and you should be getting communications for being able to register for that event, or I mean, any of the events during that weekend. In addition to that in-person celebration in September, we also are celebrating throughout the year. One way we're doing that is through these One for the Ages lunchtime presentations. We have them going on every month. You can, we update, I should say, we update this page almost weekly. Asia is very good about keeping everything updated. So as registration comes open for our upcoming events, you'll be able to click to register for the events. And then once registration closes, as long as we have that presentation recorded, you can click to view the presentation. So it's a nice collection of some of the things we're doing to celebrate our centennial. And then we also have a latest news section that features some highlight stories. So, oh, and one other way, we have a couple social media campaigns coming up that should be really fun. So you can follow us on Facebook, Twitter, and Instagram to stay up to date with things going on and getting involved and being engaged with Scripps. If you are interested in this website, we do have a shortcut URL. It's just miamioh.edu/Scripps-Centennial. So you can check that out. It's also on the homepage of our website. So it's pretty easy to find, but if you want more information or have any questions, feel free to reach out. I think that's it for the centennial, unless there's anything else you'd like me to talk about, Suzanne.
Nope, that's great. Thank you, Tasha. Yeah, it's a big year for the Scripps Gerontology Center, for sure, starting a new century. So one more little bit of news in the transition category is the announcement that I'm going to be retiring from my position as Executive Director of Scripps at the end of June this year. This is truly, I'm very excited about what my life will be like in retirement, and I'm sad about leaving this amazing group of people and this amazing organization that has been so much a part of who I am and will continue to be a part of who I am. But it's an exciting time, a new century, new leadership. We're on the cusp of exciting new changes, and I will certainly be watching with great interest, but I'll also be returning after a short break. I'll be returning to Miami to work on a few grants that I have, externally funded grants. So I'll be coming back as a part-time researcher. So I needed some sort of way to ease my transition away from this place that has been such a gift to me in so many ways. So that's a lot going on at the Scripps Gerontology Center. So now, oh, and before we move on, I do want to just, I'm sure she's not going to appreciate that I did this, but thank you, Leah, for all the work you did to make this event happen. And thanks to all my amazing colleagues for the things you're doing for the centennial. So there's a lot going on and a lot to celebrate. So now on to the reason that we are together. So let me welcome everyone officially. Welcome to the Scripps Gerontology Center staff, to our affiliated faculty, to our research fellows, to our friends. We have two, I think we have two, maybe I can see two former or two people who have also received the Cottrell Distinguished Alumni Award are here in attendance, Mark and Cho. So that's wonderful that these connections are so valuable to us. So thanks for being here. And thanks and welcome to our alums and our future alums for participating with us today. We have more than 400 graduates from our graduate degree programs in gerontology and hundreds more Miami University undergrads who have gerontology minors or majors. So we're proud of our alumni network, and you mean a lot to us, and it's great to be connected, and especially connected for an occasion like this. And I would like to offer a very special welcome to Rob and Louise Cottrell, son and daughter-in-law of Bob Cottrell, one of Doc's sons. Rob and Louise have been attending and participating in the festivities for the Cottrell Award for at least a decade, maybe more. And we're really fortunate to have you with us. So thanks for being here, Rob and Louise. You've been so supportive, so welcoming to our award winners, and they are great dinner companions. I can attest to that personally.
Thank you for including us.
Thank you. So today's event is a celebration, a time to be together, and it is bittersweet. Since the beginning of this award, named for his father, Bob Cottrell and his wife Nancy had been part of the process of selecting the awardee, and they attended every single event. Nancy passed away in 2020, and we really miss her warm, beautiful heart, her beaming smile, and her very special way of making our guests feel welcome. Bob Cottrell died earlier this year, and it's hard. Actually, it's impossible for me to talk about how much we miss him and what he meant to us. He was such a supporter of the Scripps Gerontology Center and such a believer in this award, such a believer in supporting students, and such a fan of his father's work. He was an amazing person. For me personally, he was a mentor. When I first got this job as director of Scripps 24 years ago, Bob would come and hang out, and he'd meet with me, and he had been a management executive at Kroger, and he shared with me some of his insights and lessons learned. He told me about the northbound train. He drew pictures of the northbound train, and he was a sounding board and a true friend and a colleague. So we will miss him. So Rob and Louise, thank you so much for being here and for keeping our connection strong. We do treasure the opportunity to honor the legacy of Doc Cottrell. He was a brilliant social scientist with interdisciplinary interests before being interdisciplinary was cool. His work had far-reaching impact, and I always like to mention his book called Energy and Society. That book was first published in 1955, and he talked about the relationship among energy, social change, economic development. Well, Bob was, and Doc had been in the midst of a revision when he died, and Bob's worked with us and actually worked with some of our awesome Scripps Gerontology Center staff, Lisa Grant and others, to get that second edition out the door. And that book actually was reviewed not that long ago in some environmental journals and sociology journals because of how insightful Doc was about these complex problems that are of continuing relevance today. Well, he brought that same sort of interdisciplinary integrative thinking to the study of aging. He was, and I had the great good fortune of getting to know Doc. When I first came here as a grad student, he was still here. His approach was always looking at things from all angles. He would write about the ways that societal level factors such as economics and social policy could influence an individual's experience of aging. But he never lost sight of why all of this matters to individuals, their families, and their communities. He was the star of a video that we made. We did it. So not exactly the highest quality, but it really had impact. The video was called A Day in the Life of an Older Person, and it documented some of the environmental barriers encountered in everyday life in Oxford, Ohio. So we filmed Doc while he walked up what were then very steep stairs to a Social Security office. We filmed him while he was trying to cross the street at Main and High with a very short walk light. And he was using a cane at that time. And we filmed him showing, actually acting, but showing some convincing distress at the sound of cars honking at him as he took too long to cross the street. So Doc was invested in thinking about ways we could make our communities livable for people of all ages before there was ever a thing called age-friendly communities. He was also a national leader in the field of gerontology. He was part of the first White House Conference on Aging, one of the first and most influential scholars to write about public policy and aging. Little audio visual. This is a book he wrote in 1974 called Aging and the Aged, and it was an introductory guide to understanding public policy related to aging. He was the founding director of the Scripps Gerontology Center. He facilitated our transition from our original origin as the Scripps Foundation for Research and Population Problems to becoming the Scripps Gerontology Center. He was a great thinker, a prolific scholar, a gifted teacher, a warm and generous person, and an exemplary leader. So our event today honors that legacy of leadership, big thinking, and policy in action. Thanks to Bob and Nancy's conviction that we needed to do something that was going to make a difference. A few years ago, the Distinguished Alumni Award became part of something more than just a lecture. We used to invite someone in and they would give a lecture and that was the end of it. Bob and Nancy said that's not enough. We need something that has more impact all year long and that directly involves students. And that's how the Cottrell Leadership and Aging Program was created. So our award winner spends time meeting with students. Carrie met yesterday with a group of students in a fascinating session. I know that she will be following up with some of our students. She had suggestions for, I think, every single one of them about their next professional development opportunity. So Doc and Bob and Nancy's vision for what the Cottrell program should look like has come to fruition, and Carrie's a great example. Our list of recipients of this award is illustrious, and today's honoree certainly adds some additional star power. Carrie Graham did her master's degree in gerontological studies here at Miami University. It was long enough ago that Carrie calls me Sue, and the only people who call me Sue are my family and my friends whom I've known for more than 20 some years. I won't say exactly how many. So it was more than 20 years ago, about 20 years ago, I guess, that Carrie got her master's degree. She went on to do a PhD in medical sociology at University of California, San Francisco. And she's currently Director of Long-Term Services and Supports for an organization called the Center for Healthcare Strategy. Some of you may know about that organization. It's a nonprofit organization that collaborates with states and health and human services agencies across the country to improve the way that healthcare is designed, financed, and delivered, all with a focus on improving equity, access, and quality. She also has joint appointments in the UC Berkeley School of Public Health and in the University of California, San Francisco Institute for Health and Aging. And I don't know what she does in her spare time. But her path to where she is today included a health and aging policy fellowship that she talked about yesterday is pretty instrumental in helping her figure out the next step on her path. She also was a special consultant to Governor Gavin Newsom of California to help create the first ever statewide master plan on aging for California. And that state plan remains a model for other states that are trying to follow in those footsteps, to have a cross-governmental, cross-state vision for what we want to do for our communities and our older adults. So it is my great pleasure to recognize Dr. Carrie Graham as the recipient of the 2022 Cottrell Distinguished Alumni Award. Please join me in congratulating Carrie. And from what I understand, if the timing is right, you could hold up your plaque. Is that right, Carrie? Congratulations, Carrie.
I don't know if you can see it very well.
A little blurry.
I'm going to take off my blur my background so you can see my plaque.
All
I have
right.
never gotten a plaque before. And I was telling my family, I never even knew I wanted a plaque until I got this plaque. It is so incredible. You asked what I do in my spare time. I also have 3 kids and 2 dogs, and being able to have a plaque. Look, guys, I actually have a job and do stuff. So that was really helpful. Thank you all so much for that.
Congratulations. And I'll just turn it over to you, Carrie, to say a few words.
Sure. Well, first, I just want to say thank you. This was such a surprise and unexpected, and it was so kind of you to think about me and my work and give me this award. So I really appreciate it. It's wonderful here to see my past professors like Suzanne. I won't call you Sue. I'm sorry. I don't know when that changed.
Sue is fine. Like I said, it
Old friend.
It has special meaning for me.
And to see Bob. I've been able to see Bob every few years in our world of evaluating Medicaid managed care. So it's good to see you. Katie, it's good to see you. We overlapped a little bit, and new faces too. And I also want to thank the Cottrell family for being here, and it was just so lovely to hear about all the contributions and the importance of this award. So it was very helpful for me to hear that context. So thank you. Mm-hmm. So I was asked to just speak a few minutes about kind of my work I do now and my sort of career path. Suzanne kind of went through some of that, but I came to the master's program. I think I was one of those people who always enjoyed working with older adults. And we get so many people, at UC Berkeley, I worked for a long time and had undergraduate students had this apprentice program, and they could apply to work on your research. And mostly what they would say is, I had a close relationship with my grandmother, right? And that's often how we get into gerontology and aging. And so that was the case for me. And I worked my way through college as a activity director and a social services assistant in nursing homes when I was in college, and then came across this class in college that was Gerontology 101 and thought, I didn't even know that was a thing. I mean, and I took the class and thought, okay, I don't know where this is going, but this is what I want to do. And so I think that a master's degree that was interdisciplinary was the perfect thing for me at the time, because I was sort of figuring out what I wanted to do. At the time, there was a track for becoming a nursing home administrator. There was a research track, and there was another track. And throughout the program, I just decided that I was most interested in research. And again, didn't know where it was going, but it followed my interests and what felt most comfortable for me. So I did the research. I did the research track, and then went to work for a couple years as a research interviewer in Philadelphia, where I drove around in Philadelphia, interviewed older adults in their homes with an NIA grant. And I always laugh, you could never get money to have someone drive around to interview people in their homes anymore, probably. And realized I really liked research. So did this PhD in medical sociology, and it just happened to be a program that had a really strong aging policy within its medical sociology. It was a really good start for me. It's kind of, medical sociology is a little bit like public health, but it has more theory. Medical sociologists were kind of talking about structural and social determinants of health, kind of in the early days before public health created the term social determinants of health. So that was a really wonderful program to be in. I made a career for about 10 or 12 years working at UC Berkeley and UCSF. I was trained as a qualitative researcher, and began working with the state of California and evaluating their, we called it healthcare reform in California back in the day. But really what it was using Medicaid managed care to administer Medicaid for seniors and people with disabilities. And they had been kind of exempted from managed care in California. It's a big managed care state. But I was the evaluator of a lot of different efforts to try to use managed care, both with people who had just Medi-Cal and with duals, to evaluate how these programs impacted them. And something I talked to the students about was the importance in that work of centering the experience, starting with the experiences of beneficiaries. And so my qualitative background, these were mixed method studies, but having a qualitative background, doing one-on-one interviews with beneficiaries who've been transitioned into managed care, doing focus groups with beneficiaries, beginning to work closely with the disability world. In many states, seniors and people with disability are lumped together in different aid codes. And so when you talk about one population, you're talking about the other, and becoming kind of conversant in the social model of disability and working with disability organizations, and the importance of having aging and disability sectors talking to each other. So I really worked for 10 or 15 years on a variety of evaluations for the state, and got this bug of just really liking policy. And one of the things I did a little bit differently in my work was that I worked really, really closely with state policymakers, with stakeholders, and with the beneficiaries and consumers to conduct these evaluations and give feedback to the state. And, somebody asked me when I met with the students what I was most proud of, and it was just things like, something concrete that your evaluation would impact, like how people get assessed for services, or things around eligibility for services, or how to improve care management for seniors and people with disabilities. So that it really gave me this bug for doing policy. And I think most of my career has been very much like straddling academia and policy. And it is really so strange how these are two very different worlds, where what at least I saw in California is that policymakers don't read the academic literature, and academics don't ask the questions that policymakers need answered to make decisions on their policy. And so I really became interested in these areas where you could bridge those and almost act as a researcher convener across policymakers, consumers, stakeholders. And that's something I worked in California for about a decade. I just loved working with the state. And so I went and moved to Washington, DC, and did a Health and Aging Policy Fellowship, which is a really cool program that takes people who know something about aging. Maybe you run a big program, maybe you just finished your PhD. There's different levels. There's mid-career and there's capstone people doing this fellowship. I called myself mid-career, but I don't know if maybe I was capstone. And so I worked in Congress on the Ways and Means Committee, Health Subcommittee, which people think of the Ways and Means Committee as the committee that's in charge of taxes, but they also have jurisdiction over Medicare. And so I was able to work in Medicare policy in Congress for a year. And it really changed so much about my understanding of federal policy. I had no idea. I was so naive about how policy worked its way through federal agencies and through Congress. And so that was a really, really wonderful experience. After I did that, as Suzanne said, I went back to California and I worked for the Newsom administration. And they had gotten this idea, pushed by a lot of stakeholders, that California should do this thing called a master plan on aging. And a master plan on aging it's different than like a state plan on it. There's a Medicaid state plan and there's a unit on aging state plan. But what a master plan for aging is, I came to learn, is planning for an aging state, both people who are older adults now and people who are going to be older adults in the future. So all ages and stages, they like to say, and planning across sectors within government, as well as conducting kind of a massive stakeholder input effort across sectors, industry, advocacy, providers, labor, transportation, housing, and kind of bringing together this, raising up awareness and bringing together and coordinating efforts across the state for aging and disabled populations. So I was able to work on that with California for a couple of years. And if you're interested, I'd love for you to go to look at California's Master Plan for Aging. It has been a really interesting process because just the process of creating this master plan brought together and created so many relationships between state folks. We had a research subcommittee where we brought together just researchers from all the different institutions in California, USC, UCLA, UC Berkeley, researchers from all over the place who were studying aging and disability who had never talked to anyone at the state before. And the state didn't know about their research. So we brought this research subcommittee in that has now turned into an ongoing aging research collaborative, an ongoing group that is conducting research studies for the state and sharing data and sharing information with the state. So created those collaboratives. We created, really strong bonds between the disability sectors and the aging sectors. So brought together, different departments that some worked on aging, some worked on disability, and kind of brought those together. And, and as an example of sort of an unanticipated benefit of this, you're probably all aware that with the American Rescue Plan Act, state Medicaid programs got an increased 10% federal match and got a big chunk of money. And the federal government said, all states, you have to create this plan of how you're going to use this money in the next 3 years, and it has to be focused on home and community-based services. And so California had just finished its master plan on aging. And so it had 140 initiatives. They were in 4 or 5 different domains: housing, caregiving, direct care workforce, health, and had basically a ready-made plan that had already gone through, Department of Transportation had already rubber stamped an initiative on transportation. The labor agency had already rubber stamped some direct care workforce programs to try to bolster the direct care workforce. So we were able to kind of take this money and say, look, we already have this plan. We had a bunch of initiatives in here that weren't funded, that are just sort of our aspirational goals for the state. And we're able to basically turn that around very quickly and not have to go through a big stakeholder process when we got that money. So it's been a really interesting process. About halfway through developing the master plan for aging, COVID hit. So we stopped the master plan for aging officially, but we had all these stakeholder groups who were talking to the state and doing their work and identifying initiatives. And basically the state just tapped all of those groups to help with, they helped rewrite the crisis standards of care to make sure, which are the rules for hospitals in the event that your hospital gets overwhelmed. It's basically about, like, if we have to ration care, how do we do it? And this stakeholder group came in and helped California rewrite those. The stakeholder groups working on master plan for aging helped California in vaccine distribution, because we saw that, a lot of people were having trouble getting to the vaccine site. So they created a plan to work with faith-based organizations and community-based organizations to make sure that the most vulnerable groups were getting the vaccines. They helped with, California now has a wildfire season. And you can imagine evacuating a memory care facility that also had half the people with COVID. right? And so all of those people who are working on the master plan for aging rallied around and helped the state do that. So the master plan for aging process has been really interesting and kind of fulfilled all those things that I've always was interested in terms of spanning policy and research, policy and practice, and kind of created a document that helped do that in practice and create those relationships. Now at Center for Healthcare Strategies, we're working on expanding this concept of master plan for aging nationwide. We put out a call for letters of interest for states that might want to join a multi-state learning collaborative to create their own master plan for aging. And we thought we'd get like 3 or 4 states interested. 22 states applied. So if you think about like the 5 or so states that have done either a master plan or something similar, and 22 states, we're talking about half the country that want to do this cross-sector planning for aging. So I think it's just a really exciting time that the master plan for aging also really works to elevate with non-traditional stakeholders, right? So big employers in the state that, let's say in California, it might be Google or somebody like that. Their employees are caregivers. Their employees are planning for retirement. Their employees are taking a lot of sick days because of being in the sandwich generation. So it was this process of also kind of going out to, we call them sort of non-traditional aging and disability, like non-aging and non-disability stakeholders, and convincing them that these kinds of policies are important to them, to their businesses, to their jobs, to their employees. So yeah, that's what we'll be working on next, is working with at least 10 states in our first cohort of our multi-state collaborative to create these master plans for aging. So as Sue knows, I can just go on, but I'll pause there.
Well, that's awesome, Carrie. Thank you. And I would, whoops, am I muted? You can hear me?
Oh, I can hear you.
All right. So I'd like to open it up for questions, and raise your hand or just speak up. Hand raising does help. Anybody have a question or comment? Yeah, Louise.
I'm just curious if Ohio is one of those 22 states.
I believe they submitted a letter of intent. We're waiting to see if they actually submit a request for applications.
Wow. Do we know who, Bob, do you have any idea who at the state would have done that, or did you know that was happening, Bob Applebaum?
Somebody from aging said something about it, but I didn't know if they actually sent it in or not. So
states are a tiny bit busy right now. So it's a little bit of a weird time for, to say, join this collaborative, but hopefully, we'll be providing technical assistance. We'll be able to purchase for them some technical assistance. For example, if they wanted to hire a graduate student to crunch some data on the aging of the population in the state, or hire a communications firm to host a stakeholder meeting. And also, just to say, with the master plan for aging, it doesn't supplant things like age friendly or other kind of aging initiative. It's supposed to bring all of those together. So
great, thank you. Other questions? It's hard to see, we have 2 screens. Anybody else? Question or comment? Oh, Angela.
I was just wondering what your thoughts were about that, age-friendly plans and all the research that has gone into it and the collaborations. If there's some kind of crosswalk for maximizing effort instead of inventing the wheel.
absolutely. When we just got off the phone with John A. Hartford Foundation, who's talking about, how to leverage age-friendly health systems and geriatric EDs and surgery verification, geriatric surgery verification, and all the things they're working on. So the first thing you do when you're doing a master plan is you bring all the stakeholders to the table. So, in areas that are in states that are already have an age-friendly designation, you'd bring AARP to the table, you'd bring those groups to the table. It's supposed to be working on healthcare, there'd be age-friendly health systems. It's supposed to be working on kind of environmental, which we sort of age-friendly. It should be working on housing and transportation. And for us in California, every state has their own focus, right? So California's like equity and economic security and all this. There's other states that you are not allowed to say the word equity in a state initiative, right? So every state has to kind of create their own priorities of what they're focused on. But as I said, you absolutely start by bringing together the work that's already been done and bring them together and start talking. The thing about a master plan is led by the state, right? So it should be, yeah. So anyway, I hope that answered your question, Angela.
And I see a hand from Jennifer Heston and then a hand from Bob. So Jennifer.
Actually, I think Bob was trying to break in first. So before he, yeah.
Go
He
ahead,
doesn't
Jennifer.
know, he doesn't know how to use the raised hand icon, I
Oh.
guess. Go, Bob.
Go ahead, Jen.
Well, no, I was just saying, and related to the age-friendly work, definitely if you have some examples of where states have worked really well with their age-friendly initiatives. So Ohio does not have a statewide age-friendly initiative yet, but we have a coalition of age-friendly communities that engages about 13 or 14 different communities in Ohio that now meet on a regular basis with each other. So anything that you have that, resources that you can provide. I work in that initiative and Suzanne's been doing some work with that group as well. So we'd be thrilled to have some examples of states that have done well in terms of incorporating that age-friendly work and working with those communities.
Absolutely. I think New York, so they are starting their master plan for aging. The governor announced, or maybe there already is an executive order. And it's kind of funny, once a governor says we're going to do a master plan for aging, it's like, if you build it, they will come. Funders come out of the woodwork. Everyone wants to get in on it. And so they're such a strong age-friendly state that that's where they'll start, right? They'll start there.
Mm-hmm.
So Carrie,
Thank you.
I was wondering if you could talk about a couple of things, or maybe the thing that surprised you the most that appeared in the California master plan, something you may not have expected, but there it is. And then the second part is, what is California actually doing with the master plan once they got it done? Where did they go from there?
I'm going to start on the second question first. I've already told you about the research consortium, which I always dreamed about, but I'm surprised it's happening. But maybe I can think of another example that I was surprised about. So how are they moving forward? So, now that these incredibly strong relationships have been created, both between different agencies in Health and Human Services, and between Health and Human Services and labor and transportation and all the other agencies. In addition to these strong relationships with stakeholders who all participate in the stakeholder advisory group and the long-term services and support subcommittee and the research subcommittee, we had an equity subcommittee. So I think part of what the way California is moving forward is to kind of continue those stakeholder groups, and partly the ARPA money has instigated certain areas that can be elevated. So with the ARPA money, California has certain examples like direct care workforce. Our HCPS spending plan took 7 different initiatives from the master plan for aging and funded those through the ARPA spending plan money. And so there is, and the work continues to have to be done because like all 7 direct care workforce initiatives were in different departments, right? One was for nurses, one was for our HCBS waiver workers, one was for our self-directed waiver workers, one was about stipends and training, another one was, you know, they were all over the place. So the master plan for aging kind of network kicked in, brought all of those initiatives together into a room, brought all those agencies together, and has kind of worked to patchwork and figure out kind of the synergies between all of those different direct care workforce efforts. So that's one area that's been elevated. There are, you know, there's 140 different initiatives. One thing that I'm surprised didn't happen was that a big priority in the master plan for aging was maybe trying to get one of these LTSS insurance benefits, like the Washington model. So it started out with a big focus on that. And then our governor got recalled and didn't want to implement any more taxes. And that just shut down. So, you know, it's all kind of all over the place. We still have our community-based, a big no wrong door ADRC initiative is happening through the master plan for aging with those stakeholder processes in place. Our Olmsted committee has turned into a kind of an aging disability community living work group that's working on several initiatives. They are, you know, we have a big problem with homelessness in California, and a lot of research has just come out that the people most likely to become homeless are older adults in California. So that's an initiative. Those work groups and initiatives around housing and homelessness are getting a lot of traction right now as well. So what was most surprising? Well, I mean, I think what was most surprising is that like government works in silos, just like the federal government. You know, I worked on the Ways and Means Committee and they're like, this is our jurisdiction. It's not their jurisdiction. They can't talk to us about that. You know, I mean, you've got your little area that you're jealous of. And that's the same thing in state government. And so to lead the master plan for aging, they got this woman named Kim McCoy Wade who knew nothing about aging. And she came from like kids' food stamp program, but she was a master at working state government. And so at first it could have gone that this master plan for aging was just something that was developed by the Unit on Aging that just dealt with Older Americans Act funds, just like the state plan, right? And there was a lot of pushback at first, especially the Medicaid agency is doing their total reform of Medi-Cal called CalAIM. And they were like, you can't talk about anything related to Medi-Cal at your master plan for aging meetings. She was like, oh, no. And you're going to come and we're going to talk about it together. Right. And so we, you know, all of this through this whole stakeholder process, she would like get Department of Rehabilitation or Department of Transportation to come and mutually own these areas. And then worked across department to say, hey, how about this initiative? Department of Public Health, that's on preventative issues. Okay, and then in the master plan, the different departments or agencies that were signed on to that initiative, you know, we were all listed there. Everybody had accountability. And so I think one of the most surprising things is it didn't end up as just like just another silo and a plan that lives on a shelf, because it really did span government silos, and work has to continually be done to keep it that way. But I think that was the most surprising thing, that actually that was, at least in the development of the plan, that was accomplished, because that's really hard to do.
Great, thank you. And that is hard to do.
Other questions? Comments? Louise? Or Rob?
Okay, I just have one quick question. I'm very, very impressed with the interdisciplinary nature of the work that you all do. One somewhat tongue in cheek, but not really, suggestion would be early on to help put together something that will help people navigate what appear to be hundreds, if not thousands, of different acronyms.
Oh.
You guys sit there and talk about them because I'm sure you do that every day, but particularly for your younger students and perhaps visitors or older students like us, you know, the acronyms sometimes make it difficult to navigate and understand what you're talking about.
Mhm.
Such a good point.
Such a good point. And every state's different. I'm now at Center for Healthcare Strategies, and we work with all 50 states. And every state has their own acronyms. And then the federal government has its own acronyms. So that would be a big index. But I think it's a good
I'm
suggestion.
sure it would.
And sometimes if I hear an acronym and I quickly type it in and all I know are the letters, I get like 5 different things that it could be. So
Right.
yeah, it's a really good point.
And I'm really happy you mentioned interdisciplinary, because just thinking back on, you know, starting out with a interdisciplinary degree where you learn about these different sectors and you learn about these different disciplines and the biology of aging and the policy pieces and the program pieces and the theory pieces. I couldn't think of a better educational background to be working with states on a master plan for aging, because it's about trying to make these connections across different sectors, different kinds of services. So I just think it's ironic or not ironic that, you know, starting out with this interdisciplinary degree and now working in this very interdisciplinary aging space. Just made me think of that when you mentioned it.
And I want to comment again about the list of acronyms. So we have, I mean, a lot of the people who work at the Scripps Gerontology Center have backgrounds in aging and gerontology, but not everybody. And we have 2 fabulous communications experts who are constantly saying, now, what does that stand for? What are those letters? So it's a really important message.
I think one of the things that really shaped my career is that one of my first jobs after my PhD was working at UC Berkeley. It was called Health Research for Action Center. And we did, you know, Medicaid and aging policy, but there was also just this segment of the center that did health literacy and plain communication. And they were actually practitioners. We did usability testing with beneficiaries and wrote communication material, some about whether they were going to choose managed care or not, but in other topics too. And I feel like learned so much from working with those plain communication folks, because it's not just about communicating with everyday people about their health or their services. It's also about communicating with policymakers. That plain communication and direct communication is really helpful in that environment, especially when you have a policymaker who maybe will read half a page of what you're writing and you can't use acronyms.
Are there other questions or comments? All right, well, if we were in person, this would be the point at which we would adjourn to a cocktail hour, a gathering, a social hour. So I guess we're just gonna have to gather in our own offices to have a cocktail hour because we don't get to do that in person. That is the part I miss, the networking, the making new connections. This has been fabulous, Carrie, thank you. And we got to at least see each other and hear each other's questions and reactions, but I certainly look forward to next year when I will be coming as a guest and looking forward to networking after the Cottrell event. So thank you all so much for being here. Any last closing words from anybody?
Just congratulations to Carrie and
Congratulations, Carrie. Oh, Linda, were you going to say something, or is that it?
Yes, I was going to.
Go ahead.
I just thought the same thing right before Bob said that technology is wonderful, but if we were together, people would be going up, shaking hands, hugging each other. And so I just wanted to say to Carrie, congratulations. You make me, after a 33-year career with the federal government, and you saying everything that you've done, it makes me tired just hearing you. So I don't know when you sleep, but I hope you're taking care of yourself as well. And I wanted to say to Sue Kunkel that thank you for in the 1980s being the person that sparked my interest in gerontology, and we would be also saying to you a hearty congratulations. I know you work with some of the people in these chat boxes, and so you've heard that, but I look forward to seeing you. And I also had a question, is at the 100th anniversary events, is it also for undergrads, graduates?
Yes, absolutely.
Okay, because I wanted to ask that early on because I keep in touch with some of them, and so I didn't know whether to share the information. We all know to save a date, but I wanted to share that with some people that I know are still in Southwest Ohio or that would
Yes.
travel for that. So thank
Please
you.
do spread the word. And if you want to give us names, we can even make sure they get put on an email list. Yes, we want
Okay.
everybody who has a connection to join us. So thank you, Linda.
Thank you.
Well, congratulations from all of us, Carrie. We're so happy to have you on our list of Cottrell Distinguished Alumni Award winners. And thank you to Robin, Louise, and for all of you for being here. And see you next time.
Thank you
Thanks,
all so much.
everybody.
Bye-bye.
Thank you all.